Welcome to the LDN podcast, your ultimate guide to the little-known but miraculous treatment, low-dose naltrexone, LDN, that can be used to alleviate a range of chronic conditions such as pain, autoimmunity, weight management, and even cancer. With over 90 published studies supporting its use and incredible potential, it's a shame that many people are unaware of the benefits of LDN. Don't miss an episode and subscribe now to stay updated on all the latest information about LDN. In today's episode, we'll cover the benefits of LDN, including its opioid antagonist effects, reduction of inflammation, improvement of immune function, and suppression of microglial activity. We'll also look at its effectiveness in weight management, thyroid function, and chronic disease treatment, the recommended dosage, and its low side effects profile. Finally, we'll explore how combining LDN with GLP-1 agonists can benefit patients with insulin resistance and PCOS, as well as its effectiveness in reducing inflammation, improving sleep and metabolism, and fighting chronic diseases.
Have you heard about low-dose naltrexone, or LDN for short? It's a drug that's been praised for its ability to treat chronic pain, autoimmunity, and even weight management. But the question is, why haven't you heard about it before now? Well, the truth is that LDN doesn't have the backing of a big pharma company with deep pockets. With an expired patent and relatively low cost, LDN simply hasn't attracted the kind of investment needed to conduct large-scale studies and secure FDA approval. But despite the lack of corporate interest, LDN has been the subject of over 90 published studies, all of which have found it to be an incredibly effective treatment for a range of conditions. In fact, LDN has become recognized as a safe and affordable alternative for a variety of chronic health issues, including the management of excess weight. Originally used to manage opioid addiction, by blocking the euphoria triggered by the drug, LDN has emerged as a valuable complementary treatment for many other chronic issues, providing effective symptom relief with minimal side effects. So while it may not have the same high-profile marketing push as other drugs, LDN is definitely worth exploring as a potential solution to your chronic health concerns. It might just be the answer you've been looking for. So let's dive in and talk about naltrexone. This drug has been around for quite some time and has been used to help people recover from opiate and alcohol use disorders. But did you know that it can also be used in lower doses for a variety of other conditions? It's true. Naltrexone temporarily binds to opioid receptors in the brain, promoting the production of natural endorphins. This in turn could help positively influence various medical conditions. Enter low-dose naltrexone, or LDN. This therapeutic approach has become very popular and has demonstrated an ability to alleviate a wide variety of medical conditions. Some of these are ulcerative colitis Crohn's disease, rheumatoid arthritis, multiple sclerosis, fibromyalgia, scleroderma, lupus, and Hashimoto's thyroiditis. And if you thought that was it, think again. LDN has also shown positive results in treating conditions such as depression, excess weight, and even the Epstein-Barr virus. The truth is, our natural endorphins play a crucial role in regulating our immune system, among other functions. And that's where LDN comes in, boosting our natural endorphin levels and significantly helping with various medical conditions. It is worth noting that LDN is just one part of a disease-modifying therapeutic approach. So make sure to consult with your healthcare provider before diving into this treatment method. So that's it for naltrexone, folks. We hope this information was helpful and informative. So have you ever heard of LDN, or low-dose naltrexone? It's an opioid antagonist that has been gaining attention for its potential to help with chronic diseases. But how does it work? Well, LDN actually works by boosting the body's endorphins and enkephalins. And when taken in low doses, it can promote the release of endorphins over a longer period of time. This increase in endorphins has been shown to contribute to reduced inflammation and improved immune function, which can ultimately lead to a decrease in symptoms and progression of chronic disease. But let's break down LDN's mechanism of action a bit more. According to the LDN Trust, LDN's effects occur because levo and dextronaltrexone actually antagonize the opiate endorphin receptors in the body. This causes a temporary increase in endorphin release by binding to the MU receptors. Endorphins are responsible for modulating the immune response, which can in turn reduce the speed at which unwanted cells grow. On top of that, LDN can also suppress microglial activity. Microglia immune cells are actually the primary immune cells in our central nervous system. They're responsible for the inflammatory response when our bodies are exposed to pathogens or injury. But when they're activated, they secrete pro-inflammatory cytokines, prostaglandins, nitric oxide, and excitatory amino acids. LDN has been shown to help suppress this activity, which can help to reduce inflammation and potentially downregulate oncogenes. So that's how LDN works. It's pretty fascinating to see how such a small dose of medication can have such big effects on our bodies.
When someone takes LDN, they may experience a variety of positive effects. Since LDN can boost endorphins, people often report feeling a sense of overall well-being. In fact, human trials have shown that LDN can lead to improved self-reported scores in areas such as depression, wellness, and quality of life. When you feel well, this can help lower stress levels, reduce feelings of depression, and even encourage healing. Additionally, feeling good may impact your eating habits and contribute to better weight management. It's worth noting that LDN is usually taken at bedtime. This is because the majority of endorphin production in the body happens while you're asleep. However, some people may experience changes in their sleep patterns when taking LDN at night. If this happens, taking LDN during the day could be a better option. One important detail to keep in mind is that naltrexone, the active ingredient in LDN, is administered at very low doses. This means the treatment is generally considered safe and comes with minimal side effects. Ultimately, LDN has shown promise in treating a variety of symptoms and conditions, making it an exciting area of research in the medical world.
Let's talk about LDN and its potential side effects. Although LDN is generally well tolerated by patients, it's important to be aware of possible side effects, which are typically minimal and transient. At maximal doses, naltrexone may cause side effects such as nausea, vomiting, abdominal pain, constipation, decreased appetite, headache, fatigue, insomnia, dizziness, depression, and anxiety. However, these side effects are typically not a concern with low-dose regimens. Now, who should not take LDN? It's essential to note that if you're currently taking prescribed opioid medications or street drugs in an opioid maintenance program, or taking substances like Suboxone or methadone, LDN is not recommended for you. Additionally, if you have liver problems or abnormal liver tests, are currently being treated for, or have an alcohol use disorder, or are pregnant, planning to become pregnant, or are breastfeeding, LDN is not advised. It's also crucial to discontinue LDN before surgery, or if you plan to take prescribed opioid medications. It's always best to talk to your healthcare provider about any concerns or questions you may have about LDN treatment and potential side effects. Hey there. If you've heard of LDN or low-dose naltrexone, it's important to note that LDN is not a treatment for acute conditions. Instead, LDN is most commonly used for the treatment of chronic disease. There have been over 90 studies published on the various uses of LDN, from pain relief to fibromyalgia, Crohn's disease, multiple sclerosis, systemic sclerosis, and even cancer. However, it's important to note that LDN therapy is considered off-label use and is not FDA approved for use outside of opiate and alcohol use disorder. Now, if you're considering trying LDN, it's essential to talk to your healthcare provider before doing so to ensure it won't interact with any other medications you may be taking. You should not stop any of your treatment medications before consulting with your specialist. Remember, always consult with your healthcare provider before trying a new treatment, especially if it's off-label or if you're already on other medications. Stay safe. LDN is a unique medication that requires individualization in terms of dosage. Typically, the most common LDN dosages are 1.5 milligrams, 3 milligrams, and 4.5 milligrams taken at bedtime. However, healthcare providers often start treatment at an ultra-low dose of just 0.5 milligrams per day and gradually titrate up based on how the patient responds to treatment. It's crucial that the right dose for each individual is determined, which can vary greatly from person to person, even when they are being treated for the same chronic condition. It's important to note that LDN therapy is just one part of a comprehensive treatment plan that includes a balanced lifestyle, good nutrition, exercise, and possibly other medications to achieve optimal response. That's why regular check-ins with healthcare providers are highly recommended both for progress assessment and dose titration management. If you're considering LDN therapy, it's essential to never attempt to break, alter, or manipulate naltrexone tablets to create LDN on your own. It's crucial to seek professional healthcare advice to determine the best approach for your condition and the most suitable LDN dosage to help you combat your symptoms and maximize treatment effectiveness. Remember, the ultimate goal with LDN therapy, as with many medications, is to take the lowest therapeutic dose possible, rather than the highest tolerated dose. Always prioritize the advice of your healthcare provider and stay committed to following the treatment plan they create for you to achieve optimal health outcomes. Hey there, are you struggling with chronic diseases or excess weight? It can be tough, and that's why we're here to talk about an exciting treatment approach, low-dose naltrexone, or LDN for short. It's an incredibly promising pharmacologic option that's been shown to be effective, inexpensive, and has few side effects. That's why ongoing research strongly supports its use as a complementary treatment for a variety of chronic diseases. At Pharmaprotea Compounding Pharmacy, we're passionate about tailoring our LDN treatment to fit your unique needs. We work closely with your physician partners to determine the best dosing options for each specific patient and their condition. While response to treatment can vary, many of our patients have found relief from pain, weight management success, and improvements in long-standing chronic symptoms. If you're interested in exploring LDN therapy for yourself, don't hesitate to reach out to one of our Thrive team members. They'll be happy to schedule a consultation and help guide you towards a better and healthier you. LDN, also known as low-dose naltrexone, has been found to aid in weight management in a variety of ways. One way it can help is by reducing insulin resistance. Insulin resistance not only contributes to weight gain, but also to belly fat, diabetes, heart disease, and other conditions. LDN can improve insulin sensitivity and ultimately lower insulin levels, making it easier for cells to use insulin. LDN may also be effective in curbing appetite and reducing cravings. Studies have suggested that LDN reduces the appeal of food, resulting in a decrease in food cravings. In addition, LDN can contribute to a rise in growth hormone levels, which can help build lean muscle and burn fat. LDN has also been found to have anti-inflammatory effects, promote better sleep, and improve thyroid function. Although the mechanism behind LDN's weight loss benefits is not yet fully understood, the evidence suggests that it can be a useful tool in weight management. LDN can be a helpful tool when combined with other medications to address weight loss resistance. One medication that it can be paired with is a GLP-1 agonist, such as Saxenda or Wegovy, which can benefit those with severe insulin and/or leptin deficiency or resistance. For more information on GLP-1 agonists, check out a blog post on our website. Insulin resistance, which is associated with weight gain and loss resistance, can be addressed with LDN. In a study on hyperandrogenic women, those taking up to 75 milligrams of naltrexone experienced improved fasting insulin levels, which decreased by 40%. Higher insulin levels are linked to increased testosterone, which can be found in women with PCOS. Therefore, managing insulin resistance can play a crucial role in treating PCOS. and LDN's ability to address insulin resistance may contribute to its benefit in weight loss and indirect improvement of PCOS symptoms by lowering both insulin and testosterone. Hey there! Today we're going to talk about something called growth hormone and its impact on weight loss. Did you know that a study on chronic naltrexone treatment found that it can actually decrease insulin and increase human growth hormone levels? That may not sound like a big deal, but growth hormone is super important for developing lean muscle mass and improving fat burning capacity. And when those factors come together, it can lead to weight loss. It's interesting to note that insulin and growth hormone have an inverse relationship. As insulin increases, growth hormone decreases. But with the help of naltrexone, we can shift that balance in the other direction. By lowering insulin and increasing growth hormone, we can break the cycle of weight gain and decreased growth hormone levels. This leads to the ability to develop more lean muscle mass and better calorie burning capabilities. Now let's talk about inflammation. Did you know that it's involved in the pathophysiology of many disease states? And it's also a big factor that influences weight gain and weight loss resistance. So if we can find a way to reduce inflammation, we may be able to make weight loss easier and improve our overall health. LDN is quite a popular medication, known for having a positive impact on thyroid function, and is often prescribed to individuals suffering from Hashimoto's thyroiditis. Interestingly, LDN is also renowned for having anti-inflammatory effects on the body. In a scientific article titled "The Use of Low-Dose Naltrexone, LDN, as a Novel Anti-Inflammatory Treatment for Chronic Pain," the authors suggested that LDN could help reduce symptom severity in conditions such as fibromyalgia, Crohn's disease, multiple sclerosis, and complex regional pain syndrome. The authors also reviewed evidence indicating that LDN may serve as an innovative anti-inflammatory agent in the central nervous system by acting on microglial cells. When microglia are activated, they produce pro-inflammatory cytokines, prostaglandins, nitric oxide, and excitatory amino acids, which is not good as it causes inflammation. By reducing the activity of microglial cells, the inflammatory response can be curbed. Many diseases are linked to inflammation, including those that directly affect our body weight. So it becomes important to keep inflammation at bay to maintain our health and well-being. Inflammation can have some unwanted consequences on our body. One of them is thyroid resistance, which leads to a reduced conversion of T4 to T3 hormone. This can cause a lot of health issues, including increased insulin resistance, weight gain, and weight loss resistance, and increased leptin levels, which eventually lead to weight gain. Moreover, inflammation can also trigger an increased appetite. However, there is a potential solution. By relieving inflammatory cytokines and markers of inflammation, hormone levels become more balanced and regulated, which may allow easier weight loss. According to research studies, the use of LDN can help to improve the immune system function and reduce autoantibodies in some autoimmune conditions like Hashimoto's thyroid disease. In some studies, LDN has been found to increase thyroid hormone levels while reducing thyroid autoantibodies associated with Hashimoto's thyroid disease. Hashimoto's thyroid disease is an autoimmune disease that leads to thyroid gland destruction over time, which ultimately results in hypothyroidism and weight gain and weight loss resistance. So it is essential to keep the inflammation under control to avoid these complications. Sleep is one of the most critical aspects of our health and well-being. It affects many different aspects of our lives, and one of the most significant is weight loss. Poor sleep can lead to inflammation, metabolic issues, hypertension, weight gain, and can ultimately cause or worsen sleep apnea. But did you know that naltrexone, a medication primarily used to treat addiction to drugs and alcohol, is associated with improved sleep in most patients? By improving sleep, naltrexone can lead to improvements in metabolism, insulin resistance, inflammation, and reduced pain. That's why it's preferred that patients take LDN, low-dose naltrexone, at bedtime. Some researchers suggest that LDN may be improving sleep through the modulation of neurotransmitter levels or via melatonin precursors. Of course, there's a lot that we still need to learn about the use of LDN and its effects on weight management, given the multiple mechanisms of action. However, LDN shows tremendous promise as a safe, affordable, and effective tool for achieving a healthy weight and promoting overall wellness. Since LDN is effective, inexpensive, and has few side effects, it's likely that it will eventually be regarded as one of the most promising complementary treatments for many chronic diseases.
On today's episode, we covered the benefits of LDN for treating chronic conditions, aiding weight management, improving sleep and thyroid function, and reducing inflammation and insulin resistance. However, LDN isn't suitable for acute conditions and those on opioid medication or with liver problems. Thanks for listening to today's episode. I'll see you guys at the next one, and don't forget to subscribe.